Hi, I'm Dr. Hamid Djalilian, professor of otology and neurotology at the University of California, Irvine, and chief medical advisor at NeuroMed Clinic. If you've heard that magnesium can help tinnitus and you're wondering whether that's actually true, the answer is yes, but there are really two different reasons why. For some people, magnesium deficiency itself may be contributing to the tinnitus. For others, magnesium helps because of what it does to an overactive, sensitized nervous system. Understanding that difference is the key to understanding when magnesium is actually worth using as part of an overall treatment plan for your tinnitus. On its own, magnesium will not cure tinnitus, not even close. However, there are many ways magnesium can help tinnitus when integrated into an overall medical strategy, and compared with most supplements marketed for tinnitus, the clinical evidence is strong. Magnesium affects several systems that matter in tinnitus. It helps regulate neurotransmitters, supports communication between nerve cells, protects neurons from damage, and plays an important role in the brain's ability to change its connections over time. Those functions become particularly relevant when tinnitus is loud, intrusive, fluctuating, or reactive, because in those cases, we're dealing with more than simply a signal coming from the ear. We're dealing with changes in how the nervous system is processing and amplifying that signal. So when I use magnesium for tinnitus, I'm usually thinking about one of two things: correcting an actual deficiency or using magnesium to reduce neural hyperexcitability and help stabilize the auditory system. Magnesium deficiency is especially interesting because multiple studies have found lower magnesium levels in people with chronic tinnitus compared with people without tinnitus. Researchers have found similar associations with vitamin D, and these two stand out because correcting the deficiency can potentially reverse tinnitus in severely deficient patients. That's a much more meaningful finding than simply saying low magnesium is associated with tinnitus. We sometimes refer to this pattern as magnesium-dependent tinnitus. These are patients whose tinnitus results from magnesium deficiency or clearly responds when magnesium is replaced. Of course, most chronic tinnitus is more complicated than a single nutritional deficiency. But when magnesium deficiency is part of the problem, correcting it can directly affect the tinnitus itself. For everyone else, the more interesting question is what magnesium is doing inside the nervous system and what adding additional magnesium can do. One of its most important roles is helping regulate the balance between excitation and inhibition in the brain. Two neurotransmitters that matter here are a neurotransmitter called glutamate, which is primarily excitatory, and one called GABA, which is primarily inhibitory. When that balance shifts too far towards excitation, brain circuits become hyperactive and sensory signals become amplified. That neural hyperexcitability is an important part of why tinnitus can become loud, intrusive, and reactive. Magnesium can help regulate that balance, which is one reason it's particularly relevant when we're trying to calm an auditory system that has become overly sensitive and easily activated. This also explains why magnesium helps with sleep. It calms the nervous system by supporting GABA activity and melatonin production, and it therefore enhances normal sleep regulation. That's particularly important because poor sleep can significantly intensify tinnitus symptoms. Magnesium also has antioxidant and protective effects that help protect nerve cells in the hearing system from oxidative stress, including damage associated with noise exposure. Research has found that magnesium can help reverse hearing loss after noise exposure, and daily supplementation has also been shown to help protect the inner ear against loud noise. There are multiple studies that investigate the protective role of magnesium, and if I personally ever got blasted with noise, magnesium is one of the supplements I would take to help prevent lasting damage. And there is another role I think is particularly important: nerve plasticity, or also called synaptic plasticity. That's the brain's ability to strengthen or weaken connections between nerve cells over time. Any treatment designed to retrain the brain away from tinnitus ultimately depends on neuroplasticity. Magnesium doesn't perform that rewiring for you. Instead, it supports the biological process that allow those changes to occur. So magnesium supplementation is not about directly reducing symptoms. It's about supporting the brain processes that are necessary to recover from tinnitus. This becomes even more interesting when we look at the connection between tinnitus and migraine. Our research has shown that tinnitus is intimately related to a migraine-like process in the brain, and that's especially relevant in tinnitus that fluctuates, reacts to triggers, or becomes dramatically louder after certain events. Migraine isn't simply a headache disorder. It's also a disorder of sensory processing and nervous system excitability. And magnesium has an established role in migraine treatment. A 2025 meta-analysis discussed in our full article found that magnesium reduces migraine frequency and intensity and improves overall symptom control. Magnesium also affects migraine-related neuroinflammation. So when tinnitus changes with poor sleep, stress, sensory triggers, or other migraine-like factors, magnesium may be addressing more than a nutritional deficiency. It may also be helping stabilize the neurological processes driving those fluctuations. Magnesium isn't a magic pill. Severe tinnitus can involve brain excitability, migraine-like inflammation, sleep disruption, central sensitization or brain sensitivity, and other brain network changes. One supplement isn't designed to correct all of those processes by itself. So how do we actually use magnesium? We use it as one component of a broader integrative rehabilitation plan rather than as an isolated therapy. That may include prescription medications, stress and autonomic regulation, cognitive behavioral therapy, sound therapy, and sleep optimization. The reason is synergy. Magnesium may help stabilize excitatory signaling, improve sleep, reduce migraine-like processes, and support neuroplasticity, while other parts of the treatment address different systems involved in tinnitus. That's where magnesium becomes especially useful, not as the entire treatment, but as a tool that helps the rest of the treatment work. As far as magnesium itself, we generally prefer magnesium glycinate because it minimizes digestive side effects, particularly loose stools. In our clinical trials and treatment protocols, we use therapeutic doses that can be higher than standard nutritional recommendations. Those doses should be individualized and used under medical supervision rather than copied from something you find online. At higher doses, magnesium can cause diarrhea, nausea, and abdominal cramping. It can also reduce the absorption of certain antibiotics, including medications such as Zithromax, Cipro, and doxycycline, and can interfere with medications that affect platelet function. So if you're taking prescription medications or have other health conditions, review the form and dose with your physician or pharmacist before starting a therapeutic dose. So does magnesium help tinnitus? Yes. It can directly reduce tinnitus when magnesium deficiency is part of the problem, and it can also target many of the neurological processes that make tinnitus loud, reactive, and persistent. but it works best as part of a comprehensive treatment strategy rather than a standalone cure. For the full research, dosing information, and medication interactions, read the complete NeuroMed article linked below. And if you want to understand what's actually driving your own tinnitus, take our tinnitus severity assessment.